Coming up, we'll be on location at Essential Care Clinic in Temple Hills, Maryland, discussing advances in health and wellness and how it can effectively treat health issues and improve your overall health and wellness with two of this region's top integrative health and wellness experts, Jacquelyn Bailey and Dawn Diaz Saldano. Welcome, Jacquelyn and Dawn. It's a pleasure having you both on our program.
It's great to be here.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. I wanted to begin, however, by letting all of you out there know that both these wonderful practitioners have years of medical experience, right? In
Correct.
both your cases, in the nursing field, you've been helping so many patients throughout the region and beyond over the last many years as well. And you're both recognized as top integrative health and wellness practitioners throughout the Prince George's County, Maryland region, as I mentioned, and beyond as well. And you've established a reputation for excellence as far as effectively treating many health and wellness issues, as well as for patient care. Your patients love you too. That's why we wanted to have you both on today. So I wanted to begin with you, if I may, Jacquelyn. You can certainly add to this as well, Dawn, in a moment. But I wanted to begin by having you please share the vision for your practice, Essential Care Clinic here in Temple Hills, Maryland. If you can please tell us, Jacquelyn, what was the background behind the vision, and also what you feel helps separate you and your practice apart from many of the others.
As the name says, it's essential care. I think healthcare is very essential for everybody, every human being. And that's the reason why I think it's so important that I open up a practice to give patients better healthcare options as far as educating them on what their healthcare issues are, which makes it more effective in healing process and outcome of quality of life. Those are my essential goals, taking care of the whole person, mind, body, and spirit. And I just want to mention that my focus of expertise is adult primary care.
Utilize an integrative, holistic approach, as you just touched on, looking at your patients from a holistic perspective, trying to find the root cause of the issue instead of a Band-Aid approach, if I may use that term, right?
Absolutely.
And so I wanted to then follow up by asking you, Dawn, what you'd like to add to what Jacquelyn just said.
I think as a pediatric person, educating parents, looking after children from birth to 21 years old is essential, as the name says, in keeping people healthy in the community.
Yes, indeed. Hence the name, as you just said, Essential Care Clinic, touching on the essential points that you feel are very important to help folks with, as you mentioned in your answer, and you just reiterated it with yours as well. So, now I also wanted to ask you, Jacquelyn, if I may, if you can please tell us, even though we just touched on it a moment ago, about your integrative approach to really help promote health and wellness in the community.
Well, the way I see how to promote health and wellness is by basically having patients come back to their appointment, show up for their appointment, their visit, and then follow through. Always follow through, which is very important. Like, for example, some patients may come to an appointment, get medication for a treatment, let's say strep throat. They get a medication for that. And then we said follow up, but when they are feeling well, they don't either finish the medication, which is an antibiotic, and they don't follow up. So they get a repeat of the same infection again, but it may come back worse. So I really truly believe that my approach or our approach is to not just educate, but let the patient know that they're part of the solution for their health care and promoting quality of life.
Absolutely. It's a partnership, right?
Correct.
When a patient comes and sees a healthcare provider, the healthcare provider can help them to the best of his or her ability, but it's up to the patient to do their part as well to get better. It's a team, if I may use that word.
Absolutely.
And I wanted to ask you as well, Dawn, what are some of the additional key patient benefits from this approach, in your opinion?
In my opinion, if you involve the patients from the start in their care and decision making and the decision and how they will, the treatment will work, you have better outcomes. So it's patient involvement. It's looking at the overall picture and saying, meeting the patient where they're at.
Yeah.
So it's useless to give a treatment if the patient cannot, one, afford it, cannot get to where you want them to get to. And so those are the things that I believe are important in the integrative approach.
Yes, indeed. Working together again, as we just touched on as well earlier. And I wanted to ask both of you this next question as well, beginning with you, Jacquelyn, and that is, what are some of the most common health issues that you treat here or see patients for? And I'm sure it depends on the time of the year, for example, like there, you know, and different people we're all unique. We may have similar issues, but we're all different individuals, right? So that's why these are customized treatment plans as well. But if you could please go into that a little bit in detail, just so the folks understand.
Absolutely. So asthma is one of the common treatments that happen from 6 months up to adult age and older adults. That's one of them. We can talk about strep. We can talk about hypertension. We can talk about diabetes. That's in both from childhood to adulthood.
Yeah.
Those are some of the key components. I mentioned high blood pressure, I mentioned diabetes and asthma. Those are one of the key components that you do see that is mingled in all the other cold-like viral symptoms or issues that come up.
Okay, certainly good to know. And as far as what you'd like to add to that as well, Dawn?
Something that is common that we that's near and dear to my heart would be the simple issue of bedwetting that can be treated well. So we do not focus on it, but we might miss the benefit for the patient or the child, especially. I mean, that's what we're in when we talk about bedwetting. However, if we treat it effectively, we can improve the quality of the child's socialization. So sometimes we forget that. So that's one thing that I like to focus on that is near and dear. You know, that is also part of primary care.
Yes, absolutely. That's certainly very important to know as well. And I just wanted to follow up with you as well, Dawn, by having you please tell us about some of the most effective treatment options that are available to treat some of these issues and conditions that you both just spoke about.
We focus on what is the latest research available, what is the latest recommendation by the American Academy of Pediatrics, alternative medication to treat such thing, again, bedwetting. You can do things like biofeedback, electrical nerve stimulation. So those are things that are not medicine per se. They're alternative way of treating.
Sure, yes, indeed.
But things that are really guided and by research and by the American Academy of Pediatrics.
Yes, and established medical principles.
Right.
Obviously, which you two very proudly have been adhering to since the very beginning,
Right.
Going way back with all your years of experience in the medical and health and wellness field.
Absolutely.
What type of results are you seeing in your patients, typically speaking?
Typically speaking, the results are good. They're not repeating. We don't see repeats of the same symptoms. So that tells me that our treatments are working.
Absolutely. That's a good problem. That means their problems are going away after they visit you all.
Yes.
And your thoughts on that, Dawn?
It's primary care. So we're a medical home. So what we should see is, as we see children over the years, and as Jackie see adults over the years, is that they improve, they grow, they stay healthy with the education we provide, and they're able to function in society.
Yes, and you also both utilize here, and another great benefit that I wanted to make sure all of you out there are aware of as well is that you all in your clinic, Essential Care Clinic, also utilizes, in addition to an integrative holistic approach, also you both have very good expertise on preventative care as well for your patients.
Absolutely.
And Dawn, I also wanted to ask you, for the folks out there watching, just so they have a better understanding of what the process is initially from when they first contact your clinic, and then what happens after that, typically.
So typically, patients will call in to make an appointment. We'll provide them with their earliest appointment that we have available. We'll send them a reminder, and we'll see them as they come in.
Now, folks, we are literally out of time, but I wanted to ask you both, Jacquelyn and Dawn, before we let you go, that certainly, as we mentioned earlier in this interview, you both and your clinic, Essential Care Clinic, have established a reputation for excellence in the Prince George's County, Maryland region and beyond, as I said earlier as well. You have patients coming to you from everywhere. You really utilize an integrative, holistic approach. You help your patients in a number of areas to help improve their overall health and wellness. But I just wanted to have you both take a moment, if you will, here before we let you go, just to add some additional or final thoughts before we let you go.
I just want to say that at Essential Care, we keep your health in mind. So you are the most important part of Essential Care, so I want you to know that.
I would like to say that here at Essential Care Clinic, we're here for the patients.
Yes, and that point is that when patients come to your clinic, they actually meet with either one of you. If they're an
Right.
adult, they're going to meet with you, Jacquelyn.
Mhm.
If it's pediatric related, then they're going to meet with you, the parents with their children. So that is an important point because, you have some practices and clinics that are, where the patient will go to, but they're not going to see the same doctor or practitioner each time. And here, you really bring that one-on-one, which is so important as that patient builds that trust with you on the adult side or with you on the pediatric side, as I said, that they know they're going to come here and they're going to see one of you, right, each time, which is an important point that your clinic provides.
Absolutely.
Absolutely.
And on that note, we'd like to thank you, Jacquelyn, and you, Dawn, as well, for joining us, educating the community through our program on all the wonderful benefits of Essential Care Clinic and all that you all provide to help so many folks throughout the region. It was a pleasure having you back on. We'd love to have you both back on in the future as well.
Sure. Thank you for having us.